Oke, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Welcome to tutorial of the counseling practical, especially for the reproductive system and gynecologist. So in this practicum, the docent the lecturer in charge is Ibu Cindra, Ibu Irianti, and me. Yeah. So I think you already received the case about the reproductive system. The first case is talk about some condition that may happen in the pregnancy, and then the other one about the contraceptive. I will give you some information, a little bit information for the first case first, for the some condition in the pregnancy. Yes, here are some conditions that may happen in the pregnancy. For the example, we write here in four example. The first one is the diabetes gestational, this one, and then the second one is the preeclampsia. The third one is the hyperemesis gravidarum, and then the last is GERD. This is just an example, for example, for some condition that may happen in the pregnancy. I think you already heard about the gestational diabetes. Is the condition that the blood glucose level rise up in when the pregnancy, and then the glucose level will be decreased after pregnant, after giving birth, but it may lead to diabetes mellitus in the future, And then for the preeclampsia condition is like the higher of the blood pressure in the pregnancy. Actually, the blood pressure will rise up in the second semester until the third semester, and then it's very dangerous because if the patient got the preeclampsia, it will be hijacked to the baby, and then will lead also to death of the mother. So usually for the preeclampsia condition, the patient have to take some section operations, to save the mother and the baby. And then the third one is the hyperemesis gravidarum. It's like very often, for the vomit, nausea and vomit, and then it's very hard for the mother. Okay, and the third one is the GERD. Why the GERD can happen in the pregnant? Because in the pregnant woman, because there's some pressure from the baby to the stomach, and then it will lead to make the acid liquid, to rise up to the esophagus. So that's called GERD. Okay, I will next to third slide. Okay. Actually, in the pregnancy condition or the condition in the pregnancy, if the condition need some medication, Yeah. Um, just see the pregnancy category drugs. Yeah. So I will remind you that any 5 category of the pregnancy medication. Yeah. Any category A, B, C, D, and X. Yes, so a very safe category is, of course, yeah, A category. As you can see, the definition here for the A category, uh, the medication already controlled studies showed no risk uh, to humans. Yeah, no risk to humans. Adequate and well-controlled study is in pregnant women have not shown an increased risk of fetal abnormalities. So the safety is already approved, yeah, for the A category. No harm to the fetal, yeah, the baby. So if you want to give some medication, or the doctor gives some medication to the patients, you as a pharmacy have to yeah, make sure that the medication is safe for the patients and of course for the baby, yeah, by seeing the category of the FDA, yeah, pregnancy category. Okay, here are some commonly prescribed teratogenic drugs. Yeah, as you can see, for example, like renin-angiotensin system, captopril, lisinopril, and enalapril. The category is C. Yeah, for the first trimester, and D for second and the third trimester. So you have to give more attention, yeah, for this common prescribed teratogenic drugs. Beside the angiotensin system, yeah, the agent that acting in the angiotensin, any antidepressant, anti-epileptic drugs, anxiolytic, alkylating agent. Yeah, here are also any example: endocrine, antimetabolite, carbimazole, and then coumarin, estrogen, fluconazole, lithium, misoprostol. Yeah, be careful using misoprostol. Yeah, this is contraindicated. Yeah, for the pregnancy because it will lead to uterine contraction. Yeah, because the mechanism is analog prostaglandin, so the prostaglandin will stimulate, yeah, to uterine contractions. Okay, and the other, yeah, please read this prescribed teratogenic drugs. So here are some information that must be obtained, yeah, if you do counseling to the pregnancy patients. Yeah, the first one, of course, you have to ask about the 3 prime question. Yeah, make sure that the patient uh, already know about the medication, or no, already know about how to use the medication, and then what is the purpose of the medication. Please ask that to the patients. And then yeah, same as the other counseling, you have to ask about the symptoms, about characteristic, history, onset, location, aggravating factors, remitting factors, and the others. And then you have to ask also about the other disease or comorbidities that maybe happen in the pregnant woman. Yeah, it's best you to ask about the in other disease, because you can make some consideration. You make some consideration. Is it the medication any interaction or no with the current condition, or it's the medication suitable or no, to the current condition. And then of course for the category pregnancy, also for the medication, you can get the information also from the other disease. And then please ask also about the other medication that we consumed, included OTC, supplement, and herbal. To make sure there's no interaction, to make sure that the patient use the right medication, the right medication with a very safe category. And then please ask also about the patient lifestyle. Is smoking, alcohol, dietary habit, physical activity, and the other. And then confirm the division which trimester the patient now. Okay, so actually same with the other patient. If you want to do the counseling, please ask all about the information, but maybe any additional information about the trimester, because if you know the trimester timeline or the trimester pace, you can make some conclusion. Is it the medication safe or no for the patients? Like that. Maybe the focus is to this one. So for the guideline or the other, you can follow the based on the disease. And then please check the category if you want to know is the medication safe or no for the woman. Pregnant woman, I mean. So after you obtain the information, of course you have to give some information about the disease and drugs. The medication, the information included is disease, about the disease. Just give some brief and then in lay language, and then this is focused to the disease, and from the second point until the end is focused to the medications. So give information about the indication of the drugs, and how much the dose have to be eaten by the patient, and how to use the medication, and what's the side effect, and how to manage that side effect, what's the contraindication, precautions, drug interactions, drug store, and then non-pharmacologic therapy. Okay, I think that's enough to talk about what's information that have to be obtained and then have to be informed to the patient, and then what is the point have to think by the pharmacist, if the pharmacist met with the pregnant patients. Okay, I will continue in the next part about the contraceptive.